So, Ms. Nelson, this is just some information, some case history information about your child that we're going to be answering today. And if it's okay, I'm going to write it down.
That's fine.
So, what is your relationship to your child?
I'm her mother.
And what is your child's full name?
Elizabeth Ann Nelson.
All right. And what is her birth date?
February 11th, 2011.
What are the names of her parents and guardians or guardians?
Jim and Ann Nelson.
And who are you referred by?
My primary physician, Dr. Smith.
Okay. This is some information about her communication. What are your concerns about your child's speech, language, and or hearing?
Well, sometimes when she gets nervous or she just seems like it takes her a while to be able to form her sentences, and she might stutter a little bit, and we've just kind of noticed her having a little bit more trouble with that.
Okay. And how would you describe the clarity of her speech? Easy for everyone to understand, easy for family to understand, but unfamiliar to other people, or family has trouble understanding?
It's mainly easy for family to understand because we've been around her so much, and we can pick up on it probably a little bit better than others can.
If your child is not talking, how does she express herself?
Well, she is talking, but if she does have trouble getting it out, she might maybe take you to what she's trying to get you to maybe get or pick up, or maybe take you, somewhere in another room or something like that. But she will take you there.
Okay. How well does your child respond to speech? For example, does she answer when she's called, or does she answer questions appropriately or follow directions?
She can understand. Yeah, she answers and she can understand. So I feel like she's hearing okay.
And this is just some past health history. Has your child been hospitalized within the past 2 years?
No.
Is your child currently being treated for a chronic condition?
No.
If your child has a history of ear infections, how old was the child when they started, and when was the most recent ear infection?
She did have ear infections as a baby. Probably started maybe around 3 to 4 months old is when we kind of really realized it. Now, whenever she gets a bad cold or anything like that, she may tend to develop an ear infection, so we always have to be on the lookout for that.
Has she had ear tubes?
Yes. I think that maybe ended up being around 13 months old when she had ear tubes.
Has she only had them once?
Yes.
Okay. Has your child ever been seen for a speech or hearing evaluation and or therapy by anyone other than a physician?
Not yet. We just weren't sure about it, so this is our first time kind of really reaching out.
Okay. And this is some developmental history questions. Were there any complications during pregnancy or birth?
No.
What was your child's weight at birth?
7 pounds, 5 ounces.
How old was she when she said her first word?
Kind of maybe uttered some things around 7, 8 months old.
And how old was she when she took her first steps?
I think she was around 11 months old.
All right.
I have other children, so sometimes it's kind of hard to.
No, I understand. I'm getting mixed up. As a baby, did your child play patty cake or peekaboo?
Yes.
This is some family information. Is there any other family members living in the home? Brothers, sisters, grandparents?
Two brothers.
Uncles?
2 brothers.
What are their ages?
8 and 5.
All right. What is the primary language spoken in the home?
English.
Is there a family history of speech or hearing problems?
Not that we're aware of.
Does your child attend elementary school?
Yes.
Are there any toys or games that your child prefers?
She likes to play with her American Girl dolls.
Are there any other relevant information having to do with speech, language, or hearing that you think is relevant?
Just that we've noticed that it has kind of progressively gotten worse, so we wanted to make sure that we're doing something about it.
All right, well, I'll make sure we look at this, and I'll give you a call in a few days, and we'll set up something more permanent.
Okay, thank you very much.
You're very welcome.